Alrighty, here we go. We're just going to get going. We're going to go there. We're going to go here. We're going to double check here. We're going to go here. Alright, that looks good. Everything's looking good. We're just going to post this on Twitter real quick, and then we're going to get going. So, thank you all for being here. Okay, here we go. Almost there. Here we go. Okay. Alrighty. Well, good afternoon, everyone. Good to see you. Glad you're here. This is UnShrink Me. I am Dr. Patrick Lockwood, but for the purposes of this podcast, I am merely just Patrick because please, please, please don't sue me. So, if you are new to UnShrink Me, just be aware that this is the relatively unfiltered thoughts of me. And that's it. And if you would like to comment, please do so. If you would like to like, share, and subscribe, please do so as well. If you're watching after the fact, please send some comments on YouTube, ask some questions, make some critiques, and then we will have some fun. This is UnShrink Me, and the purpose of UnShrink Me, if you are new, is to create a more informed therapy consumer base, because most of the people who are either clinical psychologists or people with various degrees in psychology talking about it are not actually trying to help create a more informed consumer base. They're just trying to either get attention or espouse a narrative about what they would like to be true. There's not a lot of real skepticism and criticism of the profession. So I'm here to be critical of everyone of every degree levels, master's level people, PhD and PsyD level people, and MD level people. Psychiatrists, psychologists, and clinicians of all degrees are not safe on this podcast because everyone has problems, which I'll talk more about today as one of the big themes of today's podcast. But again, UnShrink Me is about criticizing and satirizing everything that is true about psychology and clinical psychology, or what people would like to be true, especially therapists, because I think therapists often cause more harm than they help. I'm not against therapy. I'm against bad therapy. So this podcast is a critique and a satirization of therapy. So thank you all for being here. Please like, share, and subscribe. I will soon head to the Twitter to discuss some posts I saw. But of course, as always, this is not sponsored by Celsius. Oh, God, that's good. And I'm so grateful to have the privilege to be able to sit here and ramble into a camera and chat with people that come and talk. So thank you for being here, for those of you who are here. So today's episode, I want to talk a lot about therapist mental illness because I think it's a really important topic. And there's just so many things to say. What I would say is there's just a variety of things that have shown up in the last week. And I'd like to start with one from a person named Dr. Roger McFillin. His handle on Twitter is at DRMCFILLIN. He posted something 6 days ago, which I will retweet right now. Real quick. Sorry. Not as fast as I used to be. So Dr. McFillin posted this. I am conflicted on the issue of so many therapists pushing the value of therapy for everyone. On one hand, I want a therapist to believe in what they are doing, ... On the other hand, it's extremely concerning they are unaware of the harms of therapy, like very threatening. Be aware. So Dr. McFillin makes, I think, a very important point, in my opinion, which is there are many people that we kind of generally call the worried well. If you haven't heard of this phrase, I encourage you to think about this phrase because you might be one of them. So the worried well are people who are otherwise mentally healthy, sane, etc., with no obvious pathology, but they're struggling with distress, right? They're struggling with distress of a low mood variety or an anxiety type, or they're struggling with trust, or they just experienced a trauma. There's various types of the worried well that exist who are otherwise healthy, have decent relationships, have a stable life, stable sleep, all these things that are good for them. But because they're going through either an acute stressor or because they have a mistaken impression of their current distress, that they don't need actually therapy, but they think they do. They think there's something wrong with them, so to speak, when there's actually nothing wrong with them. And I would call those people the worried well. Many of us in the profession actually use this phrase. And many people who come to therapy are actually part of the worried well, right? Because like an example, if you just had a few more good friends to talk with you through things, you probably would never talk to a therapist because you'd have all the answers and support and encouragement and direction that you need. So the worried well is a real thing. Also, some people just flat out don't need therapy who are not experiencing significant distress, but they have like a paid best friend, which is disgusting. A lot of people that are getting what, are called generally life coaches don't need that support either. It's just people want someone to listen to them because they're not getting their attention needs or their ego needs met in other parts of their life, which is not why you go to therapy, right? You go to therapy because you have some serious, highly impairing, diagnosable issue. That's why you go to therapy. Now, that doesn't mean that that diagnosable issue is the only thing you work on while you're in therapy, because so many parts of your life are probably why mental illness shows up in your life, right? It's probably not just your core negative beliefs if you're a cognitive therapist, or your internalized object of your mom or your dad or something if you're a psychodynamic person. It's more than that. It's your sleep, it's your eating, it's your exercise, it's your relationship with your health, it's your relationship with sex, it's your relationship with your job. Your relationship with yourself might suck for various reasons in addition to your mental illness. And so there's so many things you have to work on to treat a mental illness, not just take meds and deal with your core negative beliefs. So I'm with Dr. McFillin in the sense that I think a lot of people are harmed by therapists because therapists do not do a good job of actually assessing the whole person, looking at their metabolic health, looking at, any kind of collaborative relationship with a doctor of some kind where it's like, go get your blood drawn and go see if you have too much thyroid. Because maybe you have just a thyroid problem and you don't actually have depression, for instance. So if you have a thyroid-induced depressive disorder, you don't need therapy. It might help as like an adjunctive thing, but really what you need is levothyroxine. So like that, and don't sue me, I'm not a psychiatrist, but like that's one of the commonly prescribed medications for low thyroid. So what I mean to say is there's a lot of people that are hurt by therapy, and there's tons of people who just genuinely don't need therapy because they need a dozen other things. They need better friendships. They need a better relationship with their spouse. They need a better relationship with their parents. And sometimes therapy can help with those things, but therapy is not actually necessary, right? There are ways to get those needs met in other situations with other people. So you don't need a professional, right? Also, there's a lot of therapists who are just like square peg, square hole people. They only see what they want to see. And so every behaviorist sees behavior problems. Every psychodynamic sees a parent problem. People who specialize in OCD see OCD everywhere, etc. And like, that's a real problem too. So I agree with you, Dr. McFillin, that there's a lot of people who are either on the worried well side or who are on the, what you would call, they have a bad case of what I call life sucks disorder, right? So life sucks disorder, LSD, is where you're currently experiencing a shitty situation, probably that you helped cause, and that might suck and you might be in distress, but that doesn't mean you need therapy. You need that situation to resolve. Therapy might help with that situation, but time is usually what's going to help it, right? Grief is a great example. A lot of people lose people they love every day. Every day, people are losing people they love, and that sucks and it hurts. I've lost so many people I love in my life so far, and I'm not that old yet. And so what I would tell you is that life sucks disorder is different than something that is diagnosable. That doesn't mean you can't get help from a professional. It's just that it's not necessary. Those are different things. Getting something out of it is different than needing it, if that makes sense. So I want therapists to save their space and their time for actually ill people, right? That would be my preference. So I'm with you, Dr. McFillin. And there's just a lot of selfish and stupid clinicians out there who don't know any better. On that point, I would actually like to talk about something I just tweeted about earlier. So, Nick Tabor. I'm going to talk about it right now. I'm going to tweet it. Okay. So, Nick Tabor posted this tweet 20 hours ago. And I really want to spend some time digging into this because I think it's really important. Because, again, the purpose of this whole podcast is to satirize and criticize all that is wrong with the profession so that everyone is a more informed consumer and so that you understand what you're buying when you're paying for a therapist or a psychiatrist or whatever. So Nick said, at NICKTABER, 20 hours ago, he said, "My experience has been that a lot of therapists are very shut down or blocked emotionally and psychologically, and that they think you're mentally healthy to the degree that you're as blocked as they are." So what I said earlier today, about an hour ago, is he's correct. Most clinicians are at least moderately unwell, and some are repressed, others are personality disordered, and few fully understand how unwell they are. So here's what I'd like to say about this at length. So there's all this stuff that's in the popular ethos that people talk about in the discourse about therapy. There's this thing called the wounded healer complex that people attribute to Carl Jung and other people, where it's like people come to psychiatry and mental health work because they themselves are hurt or injured or whatever it is, and they're trying to fix themselves. So they fix themselves by helping other people, and they gain mastery by helping other people, right? They see that they can help other people heal, so they feel that they can heal themselves. That's the wounded healer complex in a nutshell. There's a lot more to say, but I'm not Jordan Peterson, so I don't ramble at length about things I already understand. No shade to Jordan. I'm just not that guy. And so what I would say is it's really important to be clear about your motivations as a clinician. And very, very few people, and I'm talking about myself, people I know in the business across this country and across the world, very few people are fully aware of all the problems they have, who are psychiatrists, psychologists, MFTs, LPCCs, counselors of all kinds. Almost no one is. And why is that? Well, that's good. So, why is that? Well, it's not complicated, but it is. The not complicated version of it is people are people, right? And so clinicians are not some magical breed of people, right? I have the luxury of being a professor in a graduate school of psychology. It's a luxury. It's a privilege that I get to talk and teach the next generations of doctoral students and MFTs and things like that. So it's a lovely privilege, and I cherish it because I get to talk to the next generation, help them become more scientifically minded, understand their bias and their countertransference and all these things, so they're better clinicians and they're better scientists. That's what I want. And that fits the mission of the school. That fits how my colleagues think. And I love that. I have the best colleagues on the planet, in my opinion. And the thing about that is it's a very different experience than a lot of therapists get, right? Most people that are going to graduate school to get their degree in clinical psychology, whether it's a master's degree, a doctorate degree, or they become psychiatrists, get almost no real discussion about their personal issues. Some of them get this woke bullshit where it's like, what's your bias, what's your privilege, which is useful to some limited degree. It's not completely useless, but it's political propaganda, which is why it's mostly useless. What's useful is being aware of your countertransference when it comes to sex, sexuality, gender, age, religion, race, and ethnicity, and all these things. So being aware of countertransference is different than being aware of some sociopolitical bullshit that the right or the left are trying to feed you. Those are different problems. But being aware of your personal lived experience, your countertransference, is a completely different thing. And what Nick was talking about is there are so many people who are not actually therapists, they're preachers, they're life coaches. And what they do specifically is they do this magic act of pretending that because they have a license and a degree of psychology of some kind, that they're doing therapeutic work with you, but what they're really doing is they're evangelizing to you. And when a preacher is evangelizing to you, that makes perfect sense because they're a preacher. You know, I grew up in a Southern Baptist church, and it made perfect sense why my pastor at the time as a kid, Pastor Richard Adams, Dr. Adams, was up there telling me about the Bible and Jesus and everything like that. Because he was your typical Southern Baptist New Testament focused preacher. It made perfect sense. But when a therapist is trying to evangelize you about DBT, about ACT, about EMDR, about your trauma, about the body keeps the score, about how much of a victim you are, you're not actually experiencing therapy. You're experiencing someone who has all of their own bullshit and their own childhood issues that they're taking out on you as a professional. The people that are cultists in clinical psychology, whether they're psychiatrists or psychologists or MFTs or LPCs or whatever it is, there's so many cultists who believe in, you know, everything woke is bad or everything woke is good. Or there are cultists who believe that EMDR is the best thing since sliced bread and the body keeps the score. And if you disagree with me, you don't care about people's trauma. Those are cultists, right? Those are preachers. Those are evangelizers. And they're not well. They're not mentally healthy. There's so many very unhealthy people in psychology, partially because of the wounded healer complex, partially because of this thing called differentiation, which Bowen talked about and many other clinicians talked about. There's this idea that you can only take people as far as you yourself have gone, right? So if you're a clinician and you are afraid to look at your own childhood neglect, your own childhood shame, your own adult shame, your own internalized homophobia, whatever it is, if you're afraid, if you think, I've got no problem here, I'm fine, everything's good. If you're one of those people, then you're probably one of the sicker people in the profession. So I'm going to say that one more time. If you're the type of clinician, if you're sitting across from a therapist who's like, everything's pretty good, my life's pretty good, I'm kind of fine, then they're probably lying to you. Because there are very few actually well people in the profession. That doesn't mean they're bad at their job necessarily. But there's a lot of televangelists who are actually clinicians. But really what they are is televangelists, right? And that's a problem because it hurts people. Because it gives people the wrong kind of therapy. Because it treats them as if they need to be convinced of something, which is highly disrespectful. In the world of motivational interviewing, you're not convincing people. You're collaborators. You're having a collaborative relationship. When you're trying to convince people, that's about you and what you want. And that's highly disrespectful. That's wildly manipulative and selfish. And there are a great many very selfish therapists who have their own emotional cutoff from childhood. They have their issues with their dad, and so they're cut off with men. They have the issues with their mom, and so they're cut off with women. They can't stand their own homosexual urges, so they can't stand LGBT people. Whatever it is, right? There's just so many examples of this. And I can tell you from my own experience of being in my own therapy and being my own kind of screwed up, that the more I'm aware of that, the more that I pay attention to that, the more I can create space and create grace for the people I'm sitting across from and not make it about what I think is best for them, right? I have empirical knowledge in my head about the practice, the science of clinical psychology, and that's helpful. And I have, clinical neuroscience in my head too, and that's helpful. However, patients are not paying me for all of that knowledge. That knowledge is there and it's useful, but they're paying me for a specific kind of strategic relationship where I can be present with them and be aware of my reactions and my countertransference, and then also be aware of their reactions and their transference, like I talked about last week, and their needs and their unmet needs and their goals and their motivations, their intrinsic motivations and their extrinsic motivations, and try and craft all that together and weave it all together in a way that allows them to be kind of an actualized person, a full person, not just mechanistically treat the symptoms of anxiety and depression and trauma and shame. I'm here to create a whole person, to recreate a person in some cases, or to at least strengthen, create ego strength, create a sense of self that is collaborative, that is engaged in the outside world in a realistic way, in a negotiated way. And that's what I'm here to do, but it's never about me and what I specifically want. It's about what actually works for them. And that's what's the problem. The problem is that many of these clinicians can't tolerate their own anger, and so they can't tolerate it in their patients. Many of these clinicians can't tolerate their own shame about their ego needs, about their healthy narcissistic needs, about their sexual needs, about their aggression. Like, so many people in our profession cannot tolerate so much inside of themselves. And so when a patient brings it up, they intellectualize it, they push it off, they pathologize it, when sometimes it's not pathological, and sometimes it is. And so we have a lot of very sick people. Short story, so many sick people, so many unhealed, unintegrated people do this work. And so as for you, the consumer, please be aware that the best sounding Instagram therapists, the best sounding Twitter therapists, the best sounding life coaches are usually some of the sickest people. And the reason they're some of the sickest people is precisely because they sound so good. The more convincing somebody is, the more I would distrust them, honestly, because they're trying to sell you something. They're not trying to have a relationship with you. They're trying to sell you something. And that's terrible for everybody, because although some people think that about therapy, we're here to actually have a collaborative professional relationship. And to have a collaborative professional relationship, we are not here to sell. We're here to negotiate maybe, but not sell. Selling is a one-sided thing where I'm trying to manipulate you. So that's what I have to say about that. Thank you, Nick, for that grist for the mill there, because it's a huge part. And just to keep this train going, Jonathan Shedler, I'm just going to tweet about it real quick. God bless Jonathan. He's one of my favorite people on Twitter because he at least tries his best to be real about what he believes works. Okay, Jonathan Shedler. I just posted it if you want to check my Twitter at Dr. Lockwood. Jonathan said 3 days ago, "We have professors training the next generation of therapists who themselves understand little about psychotherapy. Someone with even a modicum of understanding would know that transference and countertransference are present in every moment as long as we are alive." So, I'm going to say that sentence of his again in case you missed it. Someone with even a modicum of understanding would know transference and countertransference are present in every moment as long as we're alive. You might as well say air is bad or water is bad. Someone with more than passing superficial knowledge of therapy research would know CBT has not shown better outcomes than psychodynamic therapy or any other bona fide therapy. It seems some professors, in quotes, don't know how to say, "I don't know," and instead teach personal prejudices and uninformed opinions as if they were established knowledge. Few students can tell the difference. They are there to be students, not to vet their professors for basic competency. They are paying for education and have a right to expect that. This is why I despair for the future of therapy professions. So, Jonathan, let me say that I share your despair to some degree because I see a lot of graduate psychology training is not going well. I talk with some of my friends across this country in Virginia and DC and Nevada and New York and Florida and here in California at different schools other than mine, and I hear things that are really concerning because, like I was just saying, a lot of people pretend, I think it's pretending, to be fair, pretend that because they themselves are professors that they are okay, number one, and number two, that their transference and countertransference experiences, their biases don't matter, which is hugely problematic. And number three, a lot of people in higher education and graduate psychology pretend that the art and science of psychotherapy are separable, which is terrible. And I mean, finally, what I would tell you is that it's not about modalities. It's not about, like, modalities matter because modalities are concepts, and these concepts in like ACT or CBT or DBT or psychodynamic therapy or IPT, there's all these different types of therapies with all these concepts, and they're good concepts, by the way. None of them are bad concepts, just so we're clear. It's just a question of who is the person? Who is the person and what do they actually know about themselves? The most important thing to me specifically as a professor in graduate psychology is who is this person? Not do I like them? Not do I think they're better than me or I'm better than them? Or they're smarter than me or I'm smarter than them? It's none of that crap that people's egos tell them is important. To me, it's very simple. Who is this person? How are they built? What's their personality style? What's their culture? What do they understand about their own biases, their own trauma, their own shame? What do they understand about their strengths as a person? One thing that's just missing in graduate psychology, in my opinion, except for maybe my program, is that it's wild to me. It's so wild to me, in my opinion, that we don't even consider the strengths of our students in many cases because we have some amazingly smart people. At least in my doctorate program and my master's program, I'm so thrilled with the quality of people in my program. I can't say enough good about them. Because what I will tell you is that, genuinely speaking, someone just chimed in, Mrs. Pegina Muckalon? I don't know who you are, but thanks for showing up. I'm telling you, like, the future of therapy is looking really scary because a lot of professors talk down. They talk down about their students. They talk shit about their students. And that's crazy because some of them are not well. As I was just saying, a lot of people in psychology are not well. Some of them are really great, really gifted, despite their limitations. So that's one thing that's missing in graduate psychology is what are your actual strengths? That's a great conversation I have with my students. And when I supervise people, I try to focus on that and build people up. But also, I try to help them be very self-critical about their counter-transference. Who are you? What bothers you? And how are you handling that like an adult? Right? How are you handling that like an adult is a conversation that's missing in graduate psychology. And I think Jonathan would agree with me. I think many people I know in my profession would agree with me. But I'm so blessed and lucky to work with my colleagues because they actually care, which is not true about many grad programs in psychology. My people care. My people care a great deal. And they want them to be well-rounded, thoughtful, scientifically minded, aware people. So our students turn out really good, in my opinion. They get good feedback at their practicum sites, at their internships. I feel very happy to be part of my university. As much as there are problems with academia at large and graduate psychology in particular, it's very clear to me that I'm a blessed person working with these people at my university and these students because we have stringent criteria for acceptance. And the people that are doing the interviewing, my faculty colleagues, are smart people who get what it means to be a good scholar and a good practitioner. The art and the science of it makes sense together. So when I go to grad school as a professor talking about transference and countertransference, all of my colleagues who have different orientations than me are totally great with it because they see the problem there too. And that's why it's great, because we are teaching people to be well-rounded practitioners. And unfortunately, many people don't do that anymore. They proselytize. They try to evangelize you to be this, that, and the other. Miss Pagina O'Muckalon says, do you think activism got very weaponized? Of course it did. Of course it did. How could it not? Like, it's very clearly the case that people who have genuine political and social complaints, people from marginalized backgrounds of every kind, have genuine complaints, right? Let me say this as clearly and unambiguously as possible. I hate activism because it's a bunch of traumatized people who have not appropriately addressed their trauma. That is separate from the people that they're fighting for having genuine complaints and problems and disadvantages and disparities. So the LGBT, racial and ethnic minorities, the poor, all sorts of people in the United States in particular have genuine complaints and experience varying levels of oppression or feeling other than that create distress and in some cases harm for them. That's real. That is real. And also, dialectical thinking, also what's real is there are a bunch of overpaid, rich, entitled, narcissistic activists who work at big organizations or universities who are very mentally unwell, who have a bunch of unresolved trauma of their own. Maybe because they're a minoritized person. I don't know, and I don't care. But as a clinician, if you're going to vomit your trauma onto me, the first thing I'm going to say to you is, why are you not okay? And the reason's because if you don't want to be okay, that's different than if you want to be okay. And some people would rather bleed all over you than actually get the wound addressed. And that's what most activists are nowadays. Because most people that are currently activists for whatever minoritized group, Uzbekistani clown performers in the United States, like genuinely don't actually care about those people. They just care about themselves and healing their own bullshit. And don't even help. They hurt. And that's why I love my colleagues, because some of them have political opinions that I disagree with or whatever, but like they're actually here to help. And they're trying to create practitioners that can actually help of all political backgrounds. Miss Pagina O'Muckalon says, what do you think of the Tavistock Institution? So I don't know much about the institution. I don't know currently what's going on. I know they have a lot to do currently with the transgender medicine debacle. And I think there's all sorts of skeletons in those closets, unfortunately. They're going to come out in the next 20 or 30 years. My genuine hope is that every institution that is working with people who experience gender dysphoria will be very clear about what actually works. Because it's very clear what actually works, right? I've worked with people who call themselves trans. I've worked with people who are very ill. I've worked with people who are not very ill. I've worked with people with obvious gender dysphoria. I have friends. I have a black friend. I have friends with gender dysphoria. And what I will tell you is that it's a diverse group of people. And they don't all need the same one-size-fits-all psychotherapy, affirmative psychotherapy. They don't all need the same one-size-fits-all hormone interventions or psych med interventions or surgeries, because they're people. And because they're people, they're complicated. It depends upon their age. It depends upon their co-occurring diagnoses. Almost everyone with gender dysphoria has one or two, maybe even three, co-occurring issues, including substance use disorders, by the way. And the CAS criteria say, literally, the WPATH criteria literally say that until those co-occurring disorders are appropriately stabilized, you should not move forward with hormones and surgery. It's not complicated, because hormones and surgery will exacerbate underlying personality disorders, underlying mood disorders, and substance use disorders. Hormones plus drugs is a terrible idea. A little bit of meth and a little extra estrogen, or a little bit of meth and a little extra testosterone is a terrible idea, right? So if you got a patient who's casually doing a bunch of meth as part of their party and play lifestyle, and you're trying to give them hormones, you're a fucking moron. And the reason you're a moron is because you're going to kill that person. That's going to hurt them. That's going to create the synergistic problem, right? Where the meth and the hormones are going to exacerbate irritability, impulsivity, aggressive urges, and if they're suicidal, that too. So it's really a problem at these institutions like the Tavistock Clinic and the various other places if they're not adequately screening for and treating co-occurring disorders. It's really not complicated. It's really, really, really not complicated. If you care about trans people, if you care about people with gender dysphoria, you will take seriously the whole person, politically, psychiatrically, drugs, lifestyle, everything, because the whole person matters. And what's missing in our conversation on Twitter and everywhere else is the fact that these are real people with real lives with complicated psychologies. Instead, it's just you're good, you're bad. You love trans people, you hate people. It's so stupid. And it's not real. What's real is these are complicated people. And that's the same thing I'm saying about psychologists and therapists. Therapists are some of the sickest people on the planet. When a therapist comes to my treatment center, I'm always exhausted before they get there because I know we're going to fight with someone's defense mechanisms. And they're not going to actually get help because they're just too sick. Therapists are some of the hardest people to treat because they're some of the sickest, most well-defended, egotistical people on the planet. And I'm one of them. And that's what's so hard about doing this work is very few people want to look in the mirror and go, what's actually wrong with me? And actually then do something about it. Because a lot of therapists believe if I'm just good at looking at other people and assessing them, then I'm okay. But that's not true. That's actually not how that works, by the way. That's actually the worst possible outcome because if you know that you're not okay, then you should be doing something about it. But instead, what happens is these people are like hurting people. They're actively trying to hurt people because they care only about what they think is wrong with the person. And they're not even remotely self-aware. They have no real understanding of who they are. Miss Pagina Omukalon says, what is your defense mechanism? My defense mechanisms tend to be intellectualizing, and I think probably one of my favorite defense mechanisms is sublimation. Sublimation is where you take your negative emotions, whatever, you take your shame, your anger, your anxiety, and you kind of like subvert them and shove them into a productive activity, right? So you take your anger and you take it to the gym. You take your anxiety and you study harder. You take your frustration and your shame and you go do better at work, right? And so defense mechanisms are not inherently bad, but the problem for most people is if you use your defense mechanisms exclusively when you're struggling emotionally, then you're never able to sit with and tolerate your feelings. So again, what I'm saying about therapists is a lot of therapists suck at tolerating their own feelings. They intellectualize them away or pretend that because they're therapist, it's okay that I have these feelings. I'm acting in self-acceptance, when in reality, they're just like using their feelings to hurt people and hurt themselves. And so what good therapists should be doing of every degree level is acknowledging their defense mechanisms like you're asking me, acknowledging their countertransference and their bias and their cultural misgivings and all these things and their values, and trying to be aware of when those things are running the ship and they're not allowing the patient to be themselves. Because sometimes it's more about us and less about them. And that's a problem. It should almost always exclusively be about them if we can try. So that's what Jonathan Shedler's talking about. That's what Roger McFillin's talking about. Therapists almost universally will do something selfish, but not know that they're being selfish. They won't know that they're trying to take it out on their patient. They won't know that their mom shit, their dad shit, their gender identity stuff, their age stuff, whatever it is. You can pick your typical obvious thing, and they just won't be aware of it. So it's not weird. It's not weird at all. Let's get to one more thing. Let's see. Can we find another thing that's on the same level here? I think I have one more post here. Let me see. Oh, yeah. So again, thank you, Jonathan, for all the things that you post, because it helps me discuss important things here. Jonathan posted something else 3 days ago, which I'll end on today as my last, at least, Twitter post. Feel free to ask more questions, share, etc. 3 days ago, I'll retweet it right now. Jonathan said, "No one can ever try therapy," in quotes, "because therapy is not a standard or reproducible procedure. The active ingredient or inactive or harmful ingredient is the individual therapist. You had one specific experience at one point in time with one specific individual. It represents nothing else." So what Jonathan's saying is, when people say, "I tried therapy, it didn't work for me," that's usually a cop-out. The cop-out is, I tried it once and I felt worse. Or I tried it once and I feel like I didn't get anything out of it. And that's bullshit. And I agree with Jonathan. He's saying the same thing. Because what you did is you had one relationship with a person that wasn't productive for you. But that doesn't mean you stop trying to have relationships, right? So there's tons and tons and tons of therapists of all genders and whatever backgrounds that you could try to have a therapeutic relationship. People with different theoretical orientations, maybe. People with different lived experiences or different knowledge bases. Therapy itself is not this product, like he's saying. There's no one standard way to do therapy. What therapy is a collaborative relationship between yourself and another person. And so what I will tell you is that if you don't like the therapist you're with, that could be completely valid on one end of the spectrum or invalid on the other end of the spectrum and anywhere in between. Because generally what's happening is that the people that you really like, that could be about your countertransference or your transference with the person. The people that you don't like could also be about your transference, but it might have nothing to do with who the person actually is. So what I will say is, if you said, "I tried treatment and it didn't help," that just means you didn't either show up the correct way or the therapist sucked at relating to you. That doesn't mean that therapy doesn't help. Again, for the people who need it, it's very helpful. We have tons of research on that. For the people who don't need it, it's a waste of time. So you might not be one of the people that actually needs therapy. That's possible. But if you do actually fit into the category of someone with a real diagnosis that actually needs therapy, you just need to find a different relationship. And that's it. And it's really not complicated. And because so many people in the profession just suck at their job because they're just regular people, there's a lot of people that aren't going to get help. The upside, though, is when you do finally meet that one therapist that you click with, where you feel like they actually get you, where they actually respect you, or they actually treat themselves with respect too, then it'll work. And it'll be great. Most people didn't date the first person they ever met and stuck with them for the rest of their lives. That's very rare. And the same thing is true for therapists. Yes, I did just burp, by the way. I was just asked, did you just burp? Yes, I did. So, what I will say is, Jonathan's correct again. It's very clearly the case that so many people who say, treatment doesn't work, therapy doesn't work. Well, that's bullshit. Sometimes there's bad treatment centers. Sometimes there's bad therapists. That's true. Some people are very blissfully unaware of how stupid they are, of how selfish they are, of how unhealed they are, of how arrogant they are. And that's very sad because it probably hurts people or at least doesn't help people. That is different than therapy doesn't work. It does. It certainly does. So what I will say is, thank you, Jonathan, as always. Okay. Next week, I will be talking more about AI therapy and the new potential dangers that lie within, because there's more research coming out. Yeah, there's more to talk about for sure. Let's see. Yeah, someone just responded 19 minutes ago. That Be Reasonable 01 said, some of my most stuck patients are other therapists. That's 100% true. So, as opposed to my normal, like, continuing to read tweets and satirize and talk about things, I'd like to spend the last couple of minutes of my podcast today talking about the challenges that a lot of us are facing nowadays. I think it's really weird, the time that we currently live in. We live in the weirdest time. We live in the weirdest time because there's so many problems. There's just so many problems. This is like that Billy Joel song, We Didn't Start the Fire, where he just lists off like dozens of things that aren't his problem, that are a problem in the world. And because there's so much shit going on in the world, it's very easy for people to get really pessimistic. And I think that's terrible. Right? All these wars, India and Pakistan, and all this shit that's happening, you know, Ukraine and Russia and Israel and Gaza and all this stuff, and it's just exhausting how much bad shit is happening in the world. The USA has an obesity crisis. It has an addiction problem. It has a mental health problem. It has a greed problem. There's all these oligarchs in charge of the country. There's all these bad things. Bad. It's all bad. Here's the problem with thinking like that, in my opinion. And I don't mean this to be Pollyanna or anything. It's like, if you're the kind of person that can listen to this podcast I'm creating right now, and you can have a conversation with me through your phone or through your computer or something, then you're probably an extremely privileged person. What I said earlier on this podcast about me being extremely privileged and blessed is 100% true. I don't know what I have done to earn and deserve this. I don't think I have, honestly. I think it's just luck that I'm here and I get to do the things that I do. I have great colleagues. I have great cats. I have a great partner. I have great family. And it's not because I'm somehow magically smart and special that I have these people in my life. I think a lot of it's luck that it's gotten me here. You could say God has gotten me here if you want. But because of that, I try to remain grateful as opposed to pessimistic. Because the people that are genuinely privileged don't get it, right? We live in a world where you can get food anytime you want. We live in a world where you can generally stay in a safe place, especially if you're in a Western industrialized country, pretty much every day of the week, every week of the year. And so what I will tell you, Miss Pagina O'Muckalon or whoever you are, you're extremely privileged. You're probably the most privileged person on the planet, Miss Pagina. And in fact, you should feel great shame for how privileged you are. Satirizing, obviously. But like, we live in an amazing time. And how cool is it that we live in a time where we have access to technology, food, water, safety that never existed in history. And so because of that, it's easy, it's extremely easy to get pessimistic because we're so comfortable when we're not built to be comfortable. Miss Pagina said, do you buy your clothes in charity shops? I bought this jacket. I didn't actually even buy this jacket. This jacket was a gift from my great uncle, Harold. So I didn't even buy this jacket. You're extremely privileged. I'm going to argue. I'm going to spend the rest of this podcast just arguing with you. You are extremely privileged. You're the most privileged person on this planet. I stand by that. So it's like, why worry? Why not have gratitude? I don't get it. I think there's so much shit that makes people healthy that's so simple, like eating enough, sleeping enough, drinking enough water. You butt your clothes in a charity shop? Well, at least type correctly if you're going to try and be funny. Come on now. So I think the problem we face here is there's so many people who just don't do the simple shit. Like so many of the worried well who come to therapy could just have better friends or sleep better or eat better or work out more and not waste their money and their time in therapy. I would love that. Right? Like if you really want to have a simpler life, you're not a billionaire? I bet you're a billionaire. In fact, I bet Miss Pagina Omaklamon or whoever you are, I bet you're Elon Musk. I bet you are a billionaire. I bet you're Jeff Bezos. And the fact that you're here typing in this chat with me tells me how privileged you are. You know what I mean? You've got to be privileged. So what I will say is, in amidst all the chaos, try to remember the simple things, because the simple things, at least in my experience, appear to work for most people. Right? Is a gratitude list going to keep you sober or safe? No. But it might make you a little less miserable. And why wouldn't you want to be a little less miserable? Why wouldn't you be? I think a lot of people want to be miserable. I think a lot of people are, they're role modeled misery. I think a lot of people believe that misery is normal. I think a lot of people think that some ambient level of anxiety and anger and frustration and resentment is a good thing. And that's why society sucks in some ways, but it's also the safest and healthiest we've ever been in many ways. So it's kind of cool. It's kind of cool. Miss Pagina says, I own nothing. How's that for privilege? Is that true though? Because you're currently typing from something. So you must own something that you're typing on to communicate with me. Unless I'm hallucinating. I could be hallucinating, which would be fascinating for me and everyone else. Am I hallucinating? Can you tell me? Am I hallucinating? Because if I am, that's a problem. Something that's weird about this is I don't know what I'm doing. And the funny thing is most therapists have no clue what they're doing. Most professors also have no clue what they're doing. And it's not because they're not competent. It's just that we're all very misled by what we would like to be true. Because what we would like to be true is what we think is true, even though it's not. Everything is rented? Are you sure? Is your hair rented or are you bald? Is your skin rented? These are important questions, by the way. As a clinical psychologist, I ask these questions. Do you own your hair? Yeah, it's kind of weird. It's kind of weird how people think there's all these catastrophes when their life is like better than it ever could be by historical standards. A lot of people just have a bad case of life sucks disorder, even though life is pretty good. So, I don't know. All I'm saying is there's a lot of sick, stupid therapists, and it's not because they're bad people. They just had bad education or bad family, or they're typically self-deceived. There's a lot of self-deception in the profession. And so what I would like for you to do is think about the person you're seeing for therapy. How aware are they of their problems? If you ask your therapist questions about their personal life, how do they answer you? If they ask you about yourself, but they seem sick themselves, what's going on there? Something's up there. It's kind of weird, right? So all I would say is be a little more choosy about your clinicians. And if anyone needs help finding a therapist, feel free to hit me up in my DMs on Twitter or leave a comment on YouTube, and I can at least help you find the right person in your area. Because I'd rather people get the help they need as opposed to just not getting help. But again, some people are just the worried well. So, maybe you don't need therapy. That's really conclusive, right? Some people need help and some people don't. That really tells you everything you need to know, right? Just like that. You know what's really absurd about this fucking planet we live on? Is that I even get to sit here and say these things. Like, how wild is it that I can be a clinical psychologist and a professor and run a business or two, and then like on my weekends grade a bunch of papers and then ramble on YouTube? Like, isn't that amazing? Isn't it amazing that people can sit here and ramble online for a living and like get away with it? Like, what a great time to be alive that we can just fucking sit here and do these things. Isn't that insane? Is that not, isn't that crazy? This is crazy to me, right? Like, how good is life when you just get to do crazy random shit for fun and even make money doing it? Like, that's awesome. And like, I'm not that special, obviously. My jacket is special, but that's because I got it from my great-great-great-great-great-granduncle, Harold, I think. But like, it's still not special. It's just a jacket. Like, you too could put on a collared shirt and a jacket and ramble online and pretend to be smart. That's all I do. And you've got this ability to do this, and everyone does. That's wild. You could even rent the equipment, right? As Miss Pagina Omukalon says. So, anyways, all I would say is I'm extremely grateful to be here. Please be very skeptical of the people that are trying to help you, because they are probably very sick themselves, and many of them are not aware of it. They're not bad people. They're just ignorant. And ignorance is not the same thing as malevolence, right? It's that Hanlon's razor. Attribute not to malice that which is due to ignorance. Ignorance is everywhere, including inside of me. So, this has been the 17th episode of UnShrink Me. Thank you all so much for coming out to watch. And please like and share and subscribe. Please send this podcast out to as many people as you can, so that not only can I get rich and famous, but also I would love to help more people find the right kind of therapist for themselves. I want to create a more informed consumer base for mental health services. That is my genuine goal. And I do that by being highly critical of the bullshit in therapy land, which is the world's worst theme park that exists. Your Instagram therapist is usually trash. Your Twitter therapist is usually trash. Some of the shit I say is trash. So be very clear that the spirit of this podcast is just trying to create a more informed consumer base. I'm not angry at a particular person. Most people who are bad at this job are not bad because they're malevolent. They're just ignorant. And that's not unusual, because most people are ignorant about most things. That's normal. Okay? So, thank you for being here. Thank you, Miss, are you married? Miss Pagina Omukalon? So fascinating to meet you. Thank you for being here. And I really hope that you come back next week and you chat and you joke around with me, because I like it and it's fun. As always, I end these episodes with a dad joke of some kind. So here we go. I once had this patient. He was a professional swimmer. He was an Olympic level swimmer. Jacked, shredded, young guy, doing really well in life. He was like succeeding as an athlete, succeeding in college. Smart kid. Very, very smart kid. And it was really fun to work with him because, sometimes smart kids are easy to work with and fun to work with. Anyways, so, he came to me because of self-confidence issues. Believe it or not, it's something I can tell you from my life as a consultant, not just as a psychologist. Like, consulting with business people, there's a small business I consult for right now with very smart, talented people. And because you're smart and talented doesn't mean that you believe in yourself. And so a lot of what I do as a clinician with very talented people, just like I do as a consultant with very talented leaders, is I try to help them figure out what they truly value and where their confidence should really lie, right? Because it's not in the egotistical stuff. It's in the real stuff, who you actually are, what your values are, and how your behavior matches your values. So I worked with a swimmer for about a year. Smart kid, doing really well in life, but also didn't believe in himself to the point that he couldn't even get in a relationship and stay in a relationship long term. But by the time we were done, he actually was able to be with his girlfriend for more than a few months, which was a miracle for him. It didn't work out, but he was able to stick it out for longer, which is progress, right? So he's telling me about the breakup. And the breakup happened in the worst possible circumstance. So he and his girlfriend went on a trip together just to kind of test the boundaries of the relationship and see how well they're doing. And they went to this part of the Midwest where there's some lakes, and they were swimming. And apparently he swallowed some parasite while they were swimming, and he had the shits all night, which was kind of this terrible intermixing of like the timing of, having diarrhea and having this, fight with his girlfriend at the same time. And he was like on the toilet arguing with his girlfriend. We were processing the breakup and what happened, and just the hilarity and the sadness of like breaking up with someone you care about and having all this diarrhea from the parasite he swallowed in the lake and all this stuff. And at the end of the session, he just kind of looked kind of despondent. He looked really sad, which made sense because like this was his first real successful relationship in years. And I tried to reinforce his confidence and how his behavior was more in alignment with his values and how he was actually kind of living a better life. He was doing better. But he looked at me and he said, Dr. Lockwood, like I can't shake the fact that this ended in the worst possible way. And it doesn't feel right. And like he's like, what do you think? And I'm like, you know what, man? Sometimes things are just kind of shitty. Thanks for coming out. See you next week. Take good care of yourselves. Eat good food. Take good care of your sleep, your sex, your health, your water, everything you need. Take good care of yourself because you matter.